Good evening, everyone. Today's the class topic is Thoraco-Lumber Spine Trauma. A brief introduction about me. I am Dr. Ekta Mishra. I have done my MBBS and MD radio diagnosis from Government Medical College and Hospital Sector 32, Chandigarh. And currently I am serving as a consultant radiology at IV Group of Hospitals, Mohali. So this is the outline of my class. We will start with anatomy, beginning with the radiographic anatomy, followed by CT anatomy, and then MR. Then we will discuss the important measurements, the biomechanical regions and the principles of acute trauma in the thoracolumbar spine, followed by common forms of fractures and the fracture dislocation in adults, the classification systems in thoracolumbar spine trauma, and in the end, we will have case discussions, which will be open for you all. So starting with the basics of anatomy. Anatomy of spine is very important because if we know the normal anatomy, then only we can identify what is abnormal. So beginning with the dorsal spine, so thoracic vertebrae are 12 in number and 5 lumbar vertebrae are there. So the general structure of vertebra. Each vertebra consists of an anterior vertebral body and posterior vertebral arch. So the vertebral body is located anteriorly and is the weight-bearing component. The vertebral arch is located posteriorly and it forms the lateral and posterior part of each vertebra. In combination with the vertebral body and the vertebral arch, there is a enclosed space which is known as vertebral foramen. The foramina of all the vertebra will line up to form the vertebral canal. And what is there in vertebral canal? It encloses the spinal cord. So what are the uses of, what is the use of this posterior arch? There are several bony prominences on the posterior arch which act as site of attachment for muscles and ligaments. So the area shaded in orange color is the spinous process. The area labeled in red is the transverse process. So these are the main bony prominences. The transverse process in thoracic vertebra will act as a point for articulation with the ribs. Then the area shaded in green color is the pedicles. Pedicle attaches the vertebral body to the transverse process. Then the area in purple or violet color is the area called lamina. It is attaching the spinous process and transverse process. The articular processes are the structures which forms joints between one vertebra with its superior and inferior counterparts. It is labeled in this color. See, this is the superior articular process. We are looking at this vertebra in an axial plane from above. And articular processes are located at the intersection of lamina and pedicle. So this is a elaborate thoracic vertebra illustration. So the additional points from the previous diagram in this slide is the costal facets, the vertebral one and the transverse process. This is the illustration for lumbar vertebra. You can go through them. So talking about the important ligaments in the spine. Anteriorly, this is the anterior longitudinal ligament, which is located anterior to the vertebral body. And posteriorly, we have posterior longitudinal ligament. Then there are ligaments which are lining the posterolateral walls of spinal canal. This is ligamentum flavum. Then there are ligaments which are located between the spinous processes, and this is the interspinous ligament. Then the last ligament is the supraspinous ligament, which is touching the tips of the spinous process. Now we'll be studying the radiograph in detail. Each and every part will be labeled, and it is very important to know the normal positions. That's why that will help us in identifying what is abnormal. So starting with the labeling, keep focusing on the number on the radiograph. So this is an AP radiograph of thoracic spine. The first is rib. I'll be illustrating it alongside. The second is the transverse process. Third is costotransverse joint. As the name suggests, it is a joint between the rib and the transverse process. And fourth is the costovertebral joint. So here you see this is the costotransverse joint and this is the costovertebral joint. Fifth is a very important structure, the pedicle. Sixth is spinous process, which is located in midline. This is better appreciated on lateral radiographs. So this is the spinous process for this vertebral body. Seventh is the inferior end plate. You have to look for the maintained continuity. The cortical outline is maintained. Eighth is the intervertebral disc space. We don't see discs on radiograph. So this is the space for intervertebral disc. Ninth is clavicle. 10th here is the diaphragm. 11th is trachea. I'm outlining it here. 12th is paraspinal line. Paraspinal line is a very important landmark. I'm outlining it. See, this is the paraspinal line. It is very important in evaluation of the posterior mediastinal masses. 13th is the aorta. So this is the shadow of aorta. So why are we discussing trachea, paraspinal line, and aorta in thoracic spine radiograph? Because these are normal structures which are seen on the AP radiograph and are not to be confused with any pathology. Coming to the lateral radiograph now. So first is the vertebral body. Second is the inferior end plate of the vertebral body. Third is again the disc space. Fourth is pedicle. See how beautifully we see it on a lateral part. The pedicle. Fifth is intervertebral or neural foramen. Sixth is the facet joint, also called as epiphyseal joint. Seventh is spinous process. I told you the spinous process is clearly seen on the lateral view. Eighth is the axillary margin of scapula. This part. Ninth is the rib head. 10th is again the part of rib, posterior rib. And 11th is the lateral rib. So rib is starting from the joint, the posterior rib and anterolateral. So here we see the posterior rib, the anterolateral rib and the rib head. Then we have diaphragm as 12th. I'll clear this page. So this is the diaphragm. 13 is the posterior costophrenic sulcus. So this part, this is the costophrenic sulcus. 14, the additional structures, heart anteriorly. 5th is the hilum of lung or lung hilus. And 16th is trachea. I hope it's clear. Now coming to the important normal variations in thoracic vertebra. All the thoracic vertebral bodies are physiologically wedged anteriorly at least by 5 degrees and not more than 2 mm when compared with the adjacent vertebral segments. Wedging is very prominent. I'm talking about the physiological wedging. It is very prominent at T12, T11 and L1, and these are normal variants. So this should not be confusing to you. These are physiological wedging. Now we'll discuss the radiograph of lumbar spine, starting with AP radiographs. So first, now you will not. I think the structure is more or less same. So you can also start labeling. First is the spinous process. It's clear in AP radiograph, we see it in the center. Second is pedicle. Very important structure for calculating interpediculate distance. The importance of interpediculate distance we'll discuss. Third is superior articular process. Superior articular process. Fourth is transverse process. And fifth is inferior articular process. So this is the superior articular process. This is inferior articular process, and transverse process is clearly outlined here. Sixth is lamina, the structure which connects the transverse process and spinous process. Seventh is another important landmark, pars interarticularis, between the articular processes. That segment is known as pars interarticularis, and if it is not intact, there is listhesis and rotational anomalies. Okay, so eighth is, you see here, the last rib, 12th rib. Ninth is the ala of sacrum, that is sacral ala. 10th is the tubercle, sacral tubercle, located posteriorly. Then 11th is the SI joint, sacroiliac joint. 12th, this area, this is the shadow of descending colon. Last but not the least, this area, this shadow is of psoas muscle. Now coming to the lateral view.